Hypoglycemia causes and prevention. Hypoglycemia occurs when your blood sugar level falls too low. There are several reasons why this can happen. The most common is the side effect of drugs used to treat diabetes. When you eat, your blood sugar breaks down carbohydrates from foods, such as bread, rice, pasta, vegetables, fruit, and milk products, into various sugar molecules, including glucose. Glucose, the main energy source for your body, enters the cells of most of your tissues with the help of insulin, a hormone secreted by your pancreas. Insulin enables the glucose to both enter and provide the fuel your cells need. Extra glucose is stored in your liver and muscles in the form of glycogen. If you haven't eaten for several hours and your blood sugar levels drop, another hormone from your pancreas signals your liver to break down the stored glycogen and release glucose into your bloodstream. This keeps your blood sugar within a normal range until you eat again. Your body also has the ability to make glucose. This process occurs mainly in your liver, but also in your kidneys. For those with type 1 diabetes, you might not be able to make enough insulin, or for those with type 2 diabetes, you might be less responsive to it. As a result, glucose tends to build up in the bloodstream and can reach dangerously high levels. But too much insulin or other diabetes medications may cause your blood sugar levels to drop too low, causing hypoglycemia. Hypoglycemia can also occur if you eat less than usual after taking diabetes medications, or if you exercise more than you normally do. Hypoglycemia in people without diabetes is much less common. Causes can include the following. Taking someone else's oral diabetes medication accidentally is a possible cause of hypoglycemia. Other medications can cause hypoglycemia, especially in children or in people with kidney failure. One example is Qualiquin, used to treat malaria. Drinking heavily without eating can block your liver from releasing stored glucose into your bloodstream, causing hypoglycemia. Severe liver illnesses such as hepatitis and cirrhosis can cause hypoglycemia. Kidney disorders, which can keep your body from properly excreting medications, can affect glucose levels due to a buildup of those medications. Long-term starvation, as can occur in the eating disorder anorexia nervosa, can result in too little of substances your body needs to create glucose. A rare tumor of the pancreas, insulinoma, can cause you to produce too much insulin, resulting in hypoglycemia. Other tumors also can result in too much production of insulin-like substances. Enlargement of cells in the pancreas that produce insulin can result in excessive insulin release, causing hypoglycemia. Certain adrenal gland and pituitary tumor disorders can result in a deficiency of key hormones that regulate glucose production. Children can have hypoglycemia if they have too little growth hormone. Hypoglycemia usually occurs when you haven't eaten, but not always. Sometimes, hypoglycemia symptoms occur after certain meals high in sugar because your body produces more insulin than you need. This type of hypoglycemia, called reactive hypoglycemia or postprandial hypoglycemia, can occur in people who have had stomach bypass surgery. It can also occur in people who haven't had the surgery. Follow the diabetes management plan you and your doctor have developed. If you're taking new medications, changing your eating or medication schedules, or adding a new exercise, talk to your doctor about how these changes might affect your diabetes management and your risk of low blood sugar. A continuous glucose monitor is an option for some people, particularly those with hypoglycemia unawareness. A continuous glucose monitor has a tiny wire that's inserted under the skin that can send blood glucose readings to a receiver. If blood sugar levels are dropping too low, some models of continuous glucose monitors will alert you with an alarm. Some insulin pumps are now integrated with CGMs and can shut off insulin delivery when blood sugar levels are dropping too quickly to help prevent hypoglycemia. Be sure to always have a fast-acting carbohydrate with you, such as juice or glucose tablets, so that you can treat a falling blood sugar level before it dips dangerously low. For recurring episodes of hypoglycemia, eating frequent small meals throughout the day is a stopgap measure to help prevent your blood sugar levels from getting too low. However, this approach isn't advised as a long-term strategy. Work with your doctor to identify and treat the cause of hypoglycemia. For further questions about hypoglycemia causes and prevention, you can contact your primary care physician or reach out to your Tria Health pharmacist.